So today we are going to talk an important topic which is regularly treated in the clinical basis, and most of the people experience this type of problems in regular basis also, mostly female. Okay. And what is the condition? That is nausea or vomiting. Okay. And another one is indigestion. These are the three diseases or three common symptoms which can appear in different diseases. Okay, it is the symptoms of gastrointestinal disease. What is nausea? How we can explain in medical terms? Nausea. What is nausea means? Here you can see in this book. Okay, what is nausea? Nausea refers to the immense desire to vomit. Means and often precedes or accompanies vomiting. Basically, nausea means you want to vomit. What is vomiting? Vomiting means the whatever content in the gastrointestine or in the stomach, forcefully you have to exploding, okay, through the mouth. It is known as vomiting. So before vomiting, you have nausea. Nausea means sensation of vomiting. Not vomiting, but it is a sensation of beginning of the vomiting. Okay, what is vomiting? Vomiting is the forceful explosion of gastric content through the mouth. Okay, this is known as vomiting. And we have other terms also. Let's talk about other terms. That is retching. Retching means uh, it is due to the respiratory efforts, you are feeling any type of vomiting sensation. Okay. And another term is regurgitation. Regurgitation is the patient doesn't have nausea, but the explosion of gastric contents will happen. Okay. In the vomiting, the patient have nausea, but in regurgitation, there is no nausea. Suddenly, the patient explodes and throughout the gastric content, whatever present, the food, the liquid, water, anything. Okay, and in that process, abdominal diaphragm, we know diaphragm is there, it will contract. Okay, in this process. And these are the less types of clinical features, but we have mostly nausea and vomiting, and we have rumination. Rumination is a regurgitation on to retrieving and a reswallowing of food from the stomach. Okay, this is the different types of terminology. Let's talk about how the vomiting and vomiting occurs. Okay, we want to know now that what happened that in the esophagus, in the stomach, we have sphincter between esophagus and the stomach. Okay, this is the sphincter which protects the re-entry of food into the esophagus. But what will happen? The pressure in the stomach increases due to the unknown reason. Okay, intra-abdominal pressure. What we call intra-abdominal pressure increases. And what happened in that process? The abdomen or our stomach will contract, and along with a diaphragm. Okay. So what will happen due to the increase in intra-abdominal pressure, the material pressure present in the stomach will come out of through the esophagus into the mouth. Here what happened? We have in the trachea and we have esophagus. So basically the food particles cannot be enter into the trachea. What will happen? It will block the respiratory system. So what we have epiglottis. epiglottis, which will protect by entering of food material into the trachea. Okay. Then what happened? The all the food material will come into the mouth and we will vomit. Okay, this is the simple physiology of vomiting. And we have the because our gastrointestinal tract have numerous connection of nerves. Okay, so it is related to the brain also. Okay, brain want to expose the to release the extra pressure, intra-abdominal pressure. So that's the reason it is helping through the vomiting. Okay, this is the thing very important. So where is the vomiting center into the in the brain? We have brain stem. What have we have brain stem areas, which with the help of chemoreceptors, the receptors absorb any abnormality in the abdomen or in the gastrointestinal tract. Okay, it will help to remove the extra intra-abdominal pressure. Okay, so this is how the the vomiting occurs, nausea occurs. Okay, so what are the reason? Very vast reasons are there, but most of the cause is indigestion. Indigestion of food, taking of extra acidic or extra masala food, which cause indigestion. And due to the indigestion, the intra-abdominal pressure will increases. So this is the most common in the 100 to 100%. We have 80% are like only. But other than that, we have three phases. We will divide the reasons into three parts. What is due to the gastrointestinal issues? Here, other than gastrointestinal issues, and we have metabolic or medication which cause vomiting. Okay, so let's see first gastrointestinal reasons. What are the gastrointestinal reasons? So we have pyloric issues. The patient pyloric is not working properly. Any issues, any obstruction in the bowel. Okay, all the types of obstruction. It may be in the stomach, it may be in the large intestine, small intestine, esophagus, or infection, mostly infection, bacterial infection, viral infection. Okay, or we can have the most common gallbladder stone or gallbladder inflammation, and we have pancreatitis due to the pancreatitis, or appendicitis or hepatitis. These are the reason. And we have the unknown reason also. Okay, and we have the last important thing, that is kidney stones. Due to the kidney stones also, we have nausea. Some patients will experience vomiting and some experience diarrhea also. Okay, other than gastrointestinal issues, we have respiratory issues, cardiac issues. Okay, other than that, no other issues. Like in the brain also, if the any damage occurs in the brain, the patient will vomiting. So whenever you remember, if any trauma occurs to the brain, any accident occurs to the brain, if the patient vomitings happening, it means it is the emergency condition. You need to treat the patient in emergency care. Okay. Means in the intracranial pressure increases. Okay, or other conditions like psychiatric illness also causes vomiting due to the depression. Okay, it will increase the acidity in the stomach. Okay, so here pulmonary issues, cardiac issues, or else brain issues. Okay, we have cerebral issues. Okay, cerebrum, cerebellum, all the brain parts included, or psychiatric illness. These are also causes of vomiting and nausea. But in this, I think so 70 to 60, 60 to 70% are due to the indigestion, proper indigestion of the food. Okay. And the metabolic causes, you have the drugs and the endocrine causes and toxins like taking chemotherapy, antibiotics, or smoking, Parkinson disease. These are the causes of vomiting sensation. In the pregnancy also, you have the vomiting sensation. Okay, in the uremia, ketoacidosis, these are the conditions. Okay, thyroid, parathyroid diseases, adrenal diseases. Okay, cancer side effects, and we have like liver failure, ethanol, taking large amount of drinking alcohol is also causing liver failure, and due to the liver failure, we have vomiting sensation. So these are the multiple causes which cause digestion, vomiting sensation or vomiting or nausea. How to treat? We have to check the reason. Okay, this is the check the reason. Which reason? Because mostly, uh, I told you that indigestion is the most of the cause. Other than that, 30 to 40%. Okay. So we have to go through the history. So you have to ask the patient if digestion is not digestion is issue. So he will tell I have regular episodes like that, and and my food is in digestion, and I have indigestion issues, constipation. Okay. If there is obstruction, obstruction will have more issues because he have abdominal pain also, along with vomiting and also abdominal pain. If it is bacteria, viral, or any inflammation, the patient will have fever or redness and tenderness is there, abdominal pain is there. And other than that, we have uh, gas um, other than that pancreatitis, hepatitis, all these conditions have some type of fever, and some have tenderness. Okay, and kidney stones, the patient will have severe pain with vomiting, and gallbladder stones have also severe pain with vomiting. So you can differentiate and you can treat the patient and according to the condition. We will talk gallbladder stone, kidney stone in the nephrology class, and gallbladder stone GI class. Okay. So how to treat? Basically, nausea and vomiting. We will treat in the allopathy. They have different types of drugs they will give. We also know that one of the most useful drug, that is Zofar. Okay, orally or IV they will give. Okay. Next is we have indigestion issue. Okay, because it is related to nausea, vomiting. So both we can study. So after that we will decide the treatment plan. Indigestion is patient have the food particles in the stomach. Okay, the food particles which are present in the stomach, it not properly digest. The digestion means here the stomach is releasing all the types of enzymes, gastric juice, pepsin, HCl, etc., etc. What will they do? They will make the food particles into the paste-like structure. Paste-like structure. Then afterward, what will happen? It will go to the small intestine. Small intestine is likely to absorb the food material. But what happening? The food particles is present in the stomach is not properly mixed up with the gastric contents or gastric digestive enzymes. So the food molecules is present there for a longer duration, and it will cause the heart burning sensation, and regurgitation, and pain in the abdomen sometimes. It's okay. And after that, if the intracranial pressure, intra-abdominal pressure increases, so you have vomiting sensation, nausea or vomiting. Okay. So this is the indigestion. Okay. So basically, in the Stomach, we have two sphincters, esophageal sphincter and pyloric sphincter. So without their permission, the food cannot be come outside the esophageal sphincter or go forward through the pyloric sphincter. Okay. So that's the reason if the indigestion food is present, what will happen? The pressure increases. Sometimes due to the increase of hydrochloric acid, which increase the intra intra uh, gastrointestinal pressure, and due to the effect of any tight clothes, it will cause also due to the pregnancy also. Okay, so smoking also, hernia causes also. So all these issues will cause increase in intra abdominal pressure. So you have to ask the patient that the patient how much time duration this problem is there, okay, and what type of symptoms you are suffering from, okay. So these are the questions you have to ask. Then you will get the basic reason behind the indigestion. So most 80% people have eating bad habit type of eating. Means they will eat fast, they will eat fast and they will swallow fast and they will walk fast. Means they are not spending 15 to 20 minutes, or sometimes it will take 25 minutes for each type of eating food. Means it may be breakfast, it may be lunch, it may be dinner. They are they eat in hurry, worry. Okay, so that's the reason they are developing indigestion issues. So basically, we have to improve our eating bad habits. So first, you have to wash the hands properly. Okay. Secondly, you have to sit down and you have to you please put the phone aside and you have to put all those things behind you, whatever want to you do. And third thing is don't eat more than two foods, two curries. More than two curries will also cause indigestion issues. So I prefer mostly one is liquid and is one is solid vegetable, which will have the balanced diet. Okay. And before eating 1 hour, mostly I prefer that you have to drink 1 glass or 2 glass of water. Okay. Which will clean the stomach. Okay. And it will prepare that the food is coming. You have to release all the digestive enzymes. Okay. Second, very important it is if you want to improve your digestion issues. And the after when you are eating food properly, you have to chew the food minimum 20 times. There are some scholars say that 40 times is good, but 20 to 40 times is good, no issues. Third is swallow not fastly, not slowly. You have to swallow the food with easily. Okay. And with don't drink water along with the food, because uh, if you drink the water along with the uh, food, what will happen? It will mix up and it will become like paste, and it is difficult to digest the food and it will take longer duration. Okay, so you have to wait for 30 minutes to settle down the food into the stomach. Then only you have to drink the water. Okay, 30 to 40 minutes. This is the best thing. And another thing, after eating food, you have to sit down, settle down 5 to 10 minutes. So this is not happening in our daily life. We are in hurry. Along with we are eating the food, we are using the phone, we are talking to the clients, and we are eating multiple foods. Okay. And other than we are not eating on time. So we have the clock. Okay. We have the clock that will make the digestion very easy, like morning 7 to 9, afternoon 12, between 12 to 2, in the night 7 to 9 again. So these are the timings in which digestion is in peak level. And if you eat the food in that timing, so your digestion will occur rapidly and you will get the strength. And third thing, it is utilized for another purpose also. If you eat the food only, uh, filling the stomach is the not the aim of the eating food. Okay, is not the aim of to fill the stomach. It is aim to get the energy from the food to all the parts of the body. Okay, so basically, like brain need energy all the time, and your liver, kidney, okay, heart, all these organs, your bones, everything need nutrition food, nutrition diet, nutritive diet. So all these things will happen only when you eat the food in proper manner. So 80% causes is there. 20% other than this, you can improve without taking any medications. If you improve your bad habits, eating bad habits, your digestion will improve and you will not get any type of gastric issues only. Okay. But patient needs treatment, they will come to your clinic and they ask, please treat us. Okay. So first simple step, you have to tell the patient to improve eating habits. Without improving eating habits, you cannot treat the patient. So please make them confident that they will improve the eating habits. Second is treatment. And the one thing is I miss in eating things, that you have to eat like in the breakfast, you have the large meal. In the lunch, you have the um, less than large meal, medium meal. And in the night, you have less amount of food you have to take. Okay, this is the best thing. Okay, what we do, we will take less amount of food in the breakfast, large amount in afternoon and night. So what will happen? What will it will do? It will get the stomach to work more on this time. But we are in the work, other works, okay, like our duty, like other things. We are in the busy schedule, so it is difficult to stomach to digest the food. So how the sun, how in the morning the sun is in peak level. Mean peak levels means the sunrise will come. So it is the beginning of our stomach. So when you eat the food, it is like young. Okay, in the afternoon it is becomes adult stomach, and in the night it will become old. So if you are taking the work from old person heavily, so he will not do. Adult person cannot do the work of the young person, and young person will do their work properly. Okay, so you have to counsel the patient. So basically treatment needs eating habits to correct properly, and you have to maintain balanced diet. You have to take the fruits weekly, thrice or 4 times. Okay, and drink lot of water. Okay, and third thing is treatment. You have to take in the electrohomeopathy. We have three remedies: S10, C10, and C15, and other than is S1 also, which mostly work on gastrointestinal tract. Okay, so in the indigestion, what we will make? We will give S10, C10, Okay, and for apply F2WE, because very important in my practice, I'm using this. You can also use this F2WE, C10, or else you can add WE also, CS10W. Okay, C10 only single, and C15 also. Okay, this is the simple treatment which will, with this treatment, patient will recover. But again, I am telling that he needs compulsory, he needs to improve eating habits. Okay, and the you can add S10 C10W like this also. If you know, if you want to give the single remedy S10 C10W, and another one is S1W, you can add to improve more. There is more lots of issues. F2W, C15. If there is infection, you have to add Ver1. You have to, if there is any issues like pain in abdomen, you have to add YE. Okay, like this, I have to select the remedy from the 38 remedies. Okay, so this is the basic prescription for improvement in the digestive issues, indigestion. And we have another remedy for nausea and vomiting. Single remedy will work wonderful. S11. Okay. S11, you have to give the patients orally in D6. Okay. Till the vomiting sensation is subsided, you have to take this remedy. After subsided, you can use for indigestion formula. Okay. So this is all about nausea, vomiting, and indigestion issues. So I hope you understood. So another thing is question. What is the question for today's class? You have to answer that. So please mention the what is nausea, what is vomiting, and what is indigestion. Okay, because if you know the details about that, you can treat easily. Okay, and what are the causes, and tell the eating bad habits in eating. Okay, and how to improve the bad habits of eating, improve of bad habits of, I already told in the class, improve our bad habits in eating. And last one is treatment. Okay, this is the question you have to answer and you have to write. Please put the book, okay, and write down in the book. Okay, because whenever you need, you can get the answer from that and you will treat the patient. And the last thing, I forgot that. The thing is, in the afternoon, you have to take a nap, which will improve the metabolism in the body. So after eating lunch, you have to take 15 to 20 minutes, medium nap, which will improve the metabolism and brain strength. Okay. So it is also help in the indigestion issues. Okay. Dilutions here mostly, this is the indigestion issues because it is mostly present chronically. You can use D4 or D5. Mostly D4 and D5. Here D6, S11. S11W also you can use. Or sometimes there is a lot of vomiting sensation. You can add F1 also because it is connected with the nervine. So one F1 or else you have to apply S11 F2W also this in this area brainstem. Okay, because we already studied brainstem is related for vomiting. Okay. In the traveling sickness, some patient to develop vomiting sensation, you can use S11, wonderful remedy. Before traveling, you have to start before 1 hour. It will definitely stop the traveling sickness. Okay, whoever have vomiting sensation by traveling, they can use S11. Only S11 will help. If mostly the patient will have other symptoms other than vomiting, you can use WE along with F1, or you can apply S11 F2 WE. Okay, in the brainstem area. Okay, so this is all about in today's class. Any doubts, kindly ask. Thank you.